Welcome back. Everyone agreed there was a problem with the sheer number of homeless on the streets of Sarasota. The solution, well, that was a different story. In 2013, the city hired national homelessness expert Dr. Robert Marbut, but he developed a comprehensive plan to address the issue locally. The only recommendation of his that wasn't followed was building a come-as-you-are shelter. Debate ensued over where it would be located, with residents pushing back against locations in the city limits and locations in the county being too far away from other resources. The city's first attempt at Housing First was marred after the man hired to run it, Doug Logan, was forced to resign for violating Florida Sunshine Law. But now, New Hope, the city and the county are working together with the Salvation Army and other organizations to push ahead with Housing First. What can we expect this time around? And joining us for more is Ed DeMarco, acting executive director of the Suncoast Partnership to End Homelessness, and Tom Barwin, the city manager of Sarasota. Gentlemen, thank you for joining us today. You know, in Kate's story, she looked at other states where this is employed and with some pretty dramatic results, which begs the question, if this was such an obvious direction to go in, why hasn't it taken all this time to implement it here?
Well, it wasn't such an obvious direction to go in, and it's really counterintuitive, I think. We've gone through a huge learning curve as a community in terms of what actually homelessness is, why it is taking place as it is, what afflictions and problems people have that resulted in their being on the street. So we've had to go through a huge learning curve and come to this conclusion that any sheltering or emergency sheltering needed to be calibrated and coordinated with long-term housing, rapid rehousing and long-term permanent housing.
Ed, the question I always ask, and I don't know if I ever get a good answer to it, is why is there such an acute problem with homelessness here in Sarasota County, in the downtown area? It's really unlike many communities around Florida and around the country. I mean, I could say, boy, I never saw it worse than Philadelphia, but Sarasota is a pretty good runner-up.
Well, I don't know that it's any worse or better than other communities. I know it's bad in Miami and it's bad in Jacksonville, but Sarasota has a unique issue. All of everything's near the coast. All of the services, all of the providers, all of the help is right near the center of things in city of Sarasota. So those who are homeless, instead of being spread out over a larger area, they all congregate where services are rendered. So they congregate where they can get meals, they congregate where they can get support, they congregate where they can find someplace to stay on a bad night like tonight.
And Alan, it's true, this is a huge problem in many, many communities across this country. You've just been to Hawaii, Ed. I've been to San Francisco, Seattle, Vegas. Our hot team has gone to Philadelphia, San Antonio. It's a huge national problem, and we could get into the reasons or a bigger conversation on that someday. But Sarasota, once known as one of the meanest cities in America, ironically is the only community in Sarasota County that has issued a permit for a shelter, that has issued and permitted a daycare drop-in center. And we're also the home community to most of the social service providers. So that explains a big part of the reason why you see, in effect, a magnet effect of homelessness and the challenges that they face being drawn to the community.
And in places like Hawaii and in Seattle, the homeless problems are so significantly worse because they don't have supportive services, and they provide permits for people to stay almost anywhere.
How unusual is it for communities to have their primary shelter located at a Salvation Army, which is, you know, not a public institution? Most or many communities, I would imagine, find a way to have shelters.
Well, it's historically kind of normal to have the sheltering near or in a downtown, if you look back over the last 50 years. But when a lot of these began, it was when our downtowns were emptying out and when they were the low-income areas and sometimes abandoned areas. But, you know, as we've seen, our downtowns have come back around America now. They're very popular places. Tallahassee, which we visited just months ago, had a downtown shelter, and they moved the shelter 5 miles, 6 miles out of town. And amazingly, that really impacted the challenge that they had in downtown Tallahassee.
For the better or for the worse?
For the better. It got that social group away from the easy drugs, the return to prostitution, the alcoholic clique that they were hanging around with, and put them out into a more therapeutic environment.
But Ed, the argument here in Sarasota has been, if you're taking the homeless out of downtown, you're also taking them away from where the services are located.
And that is a continual yin and yang, if you will, of those kinds of problems. But, you know, when you talk about dealing with the problem of homelessness in Sarasota, it's not just about, is there a place for them to stay right now, a shelter? It's about, what are we going to do long term? Because you can move them from shelter to shelter, and the person who's homeless is still homeless.
And we will pick that up in just a moment. We will just getting started with this conversation. We'll be back right after we check our weather. Welcome back. If you're just joining us, we are discussing Housing First. Sarasota's city and county governments recently agreed on pursuing this approach to help the homeless. Our guests tonight are Ed DeMarco from the Suncoast Partnership to End Homelessness and Tom Barwin, Sarasota's city manager. Boy, I remember not all that long ago, beginning this broadcast, was saying that the city and the county do not have their act together. That's when everything fell apart over the approach. How did you basically put Humpty Dumpty back on the wall?
Well, I think everybody stepped back, took a deep breath, and we found a really credible expert in the state named Susan Porchot, who was with the Florida Housing Authority, and we retained her under contract to come in and assess what we are doing as a city and a county. Mm-hmm. And she's quietly, very quietly over the last 6-7 months, gone around our county and met with elected officials, most of the service providers. She's interviewed the employees of the Continuum of Care, the Suncoast Partnership to End Homelessness, and evaluated and judged what our gaps are here based on her vast experience throughout the state in this arena. And she's identified some important gaps that has been put in this report called Creating an Effective Homeless Crisis Response System. And both the city and the county boards have adopted this report for implementation. So that is great, great news, Alan.
For so long, we were talking about two different approaches, Housing First and Come As You Are. Ed, very briefly, can you, tell folks what the difference between those approaches are?
Housing First starts with the idea that no matter who we are and what our problems are, we're better if we're in a permanent place. We're better if we have a shelter over our head. The idea in the past has always been, let's fix people and then find them a house. And we found that the results of that weren't all that great. And we found that the results are better if we get a person in a house and then work with them and provide supportive services on an ongoing basis for a period of time to assist that person in adapting to being in a home of their own, an apartment or a permanent supportive housing situation.
All right, so let's talk about some of the obstacles that still lie ahead. And as we were talking during the break, you have a very interesting issue on the Suncoast. You have Sarasota County and Manatee County. Sarasota, the county and city are becoming better coordinated, but now you have another municipality and county government just up the road. Is there an issue there?
Well, if I could just supplement the last comment of Ed's, national data indicates that an individual has been on the street for 3 years or more, they have 3 problems usually. 75% of the time, 3 problems. They have probably a physical disability, a mental health disability, and a substance abuse problem, which is why it's so critical to get a roof over their head so they can stabilize. But with that said, our planning area is the 2 counties, and we are required to have a continuum of care. And a large part of this report speaks to beefing up that continuum of care, reorganizing it, getting the right leaders on it, and then getting the funding in place that's necessary across our 2 counties.
Right. So are you all in Sarasota County and Manatee County working on the same page and the same philosophy?
We're working on the same page and on the same philosophy. and I say
You're
that
saying a lot there.
No, what I'm saying is that a member of the board of the county commission is on the board of the Suncoast Partnership and has reviewed the elements of this plan and has said, yes, we want to go forward with it. From Manatee County. That's a big plus. The Manatee County hasn't seen this report, and it wasn't really written about Manatee County's problems specifically, but could be addressed across both of our counties easily. So we are working on it. Isn't a bad thing, because the Susan Porchio report came out, what, 2 months ago, and we're now in the process of getting everyone who's involved in the continuum of care, City of Bradenton, Manatee County, Palmetto, all of the different jurisdictions, and all of the providers, people like Turning Points, the Salvation Armies in Manatee County, and getting them all involved in trying to move the whole area forward with Housing First.
Of course, many people who are watching this right now might be asking, how are we going to pay for this?
Well, that's a great question, and one of the recommendations in this report is to identify a funders group that works with the continuum of care to raise the money necessary.
How much money are we talking about?
Well, here's the plan. An individual who ends up in an emergency shelter should be there, generally speaking, no longer than 30 days. And then we need to move them into rapid rehousing, which is a roof over their head for about a year. That's about $8,000 a year. And we need about 85 of those units. Right now in Sarasota County, we only have 32. So we need to really beef up the rapid rehousing element of our approach. And that really is our rental units, scattered site rental units. And then and usually 75% of those people move along and stabilize their lives. And there's about 20% that will need to be in permanent supportive housing. And so we need to keep working on that. And that's about 10,000 a year.
You mentioned Renaissance Manor and the program that they have in your spot at the beginning of the program. That is a permanent supportive housing environment where people with special needs who otherwise would not be able to take advantage of rapid rehousing are housed without an end point being identified.
But again, the question is, where does the money come from? Because as we saw from our state budget process, money is really tight on the state level, and I would imagine, you have a new sheriff in town in Washington, and how secure is your federal funding?
Well, one of the things to be clear, we do have money for rapid rehousing available. We have money for about 140 rapid rehousing units, more than what Susan Porchio recommended in her report. Our problem has been twofold. One, the coordination up front to make sure that people are offered that opportunity, and two, getting landlords and others in the community to say, yes, I'll work with those who are homeless and give them an opportunity to stay. And until we get both of those ends, rapid rehousing becomes a nice term, but doesn't really get people in to a house or into an apartment.
But the funding will be a blend of
Yes.
federal funds that we qualify for,
That's
state
right.
funds that are available, local funding, and I'm glad to say our philanthropic community has stepped up and is very interested in this. They were waiting to see if the city and the county could come up with a viable plan. Now that that's happened, they're committed to helping us work on this challenge.
There's a whole nother topic here which is connected to this, and that is the fact that we are basically dead last in the country in terms of mental health funding, and that's something that the legislature has really not addressed, and we have done that over and over again on this broadcast. Let's take a quick break, and when we return, we'll have final thoughts on Housing First, plus what some of our viewers are saying about last night's topic, preparing to welcome the Atlanta Braves spring training to Northport. Welcome back. Well, taking a Housing First approach helped find permanent housing for homeless individuals on the Suncoast. What more should be done to complement the program? Our guests join us right now for final thoughts. And Ed, I want to ask you, a year from now, as this gets going, are we going to see fewer people on the streets? What more needs to be done that's not being done right now?
I think we are going to see fewer people on the streets. I think we're going to see a more coordinated effort throughout both counties. I believe that's going to happen. I believe we have the dedicated people in both counties, both from case managers all the way up to people like Tom, city managers and commissioners who want to make this happen. And I believe it's going to happen. We're going to have great success here in Sarasota and Manatee counties.
Tom, if you could take a moment to address the people who I'm sure are going to be writing in tonight on Facebook, and we want those comments to say, treat them like vagrants. That's what they are. Just get them out of downtown because it's affecting our quality of life.
Well, it's hard. It's got to be careful about generalizing about everybody. It's a complicated population, but there are an element of the chronically homeless that end up being more criminals and vagrants than not. We had an incident in the last couple of weeks where we've had a contact with a woman, our homeless outreach team, over 100 times. She stole a $3,000 wheelchair from Sarasota Memorial Hospital. She was in jail. She would have been a prime candidate for the comprehensive treatment court, where the judge can put leverage on the individual, say, hey, you either respond to the treatment and get yourself organized, or you will in fact be in jail. So there are cases we have to prosecute. There are individuals who exhibit criminal behavior, and they do need to be treated like criminals when they won't respond to the service network that's in place. So that's an element of it.
That's a small percentage, though. The vast majority are episodically homeless, are homeless for a period of time, and need just a little help to get back into a housing situation. And I really believe that people who would say treat them like criminals don't understand the cost to the community when a person's treated like a criminal.
And we will have to leave it there, gentlemen. Thank you. But before we go, we want to share with you what some of our viewers are saying about last night's topic, getting Northport ready to become the new home of the Atlanta Braves spring training. The team has agreed to a 30-year deal with Sarasota County. West Villages is offering up the land for a stadium and training facilities. Now, funding is the final hurdle for getting it built by 2019. West Villages plans to ask the state for $20 million, but the funding is still pending, and we asked you what you thought about the process. Robert Langfelder writes, would love to see a walkable town center with affordable townhomes and villas within walking distance to the stadium, shopping, and medical facilities. Roger Dresden writes, you could save a boatload of money and leave the open field alone. Don't need a carpet-bagging team here. Ouch. And Dan Koritsky writes, corporate welfare, stop counting spending by locals to justify these facilities. Well, what do you think about Housing First approach to homelessness? Join the conversation by visiting our Facebook page at facebook.com/news@7. And FYI, you can watch past Roundtable discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. Thanks to our guests for being here tonight. Ed DeMarco is the executive director of the Suncoast Partnership to End Homelessness, and Tom Barwin is the city manager of Sarasota.